International Airport. As the Director General put it, we are going to open the airport in phases. In phase one, we have regulated flights into and out of Entebbe International Airport. How have we done this? By staggering or by separating the arrival time. And this one has greatly reduced the number of flights into Entebbe International Airport. By doing this, we don't want to overstretch our capacity. We want to handle the numbers that our capacity, our current capacity on ground can facilitate. And through this, we think that the closure of the two lounges for works will not affect this. Those two that have been hoarded off, already as we talk now, the works are around 50%. And we think within 15 days from now, the already hoarded off will be open. And then we will hold off the remaining part also for works. Yes, we are confident that the facilities we have are going to facilitate the numbers that we are going to start with.
Thank you very much. As usual, our good friends, members of the press, members of the Ucaa management and other stakeholders, ladies and gentlemen, it is always a pleasure for us to welcome you here at Entebbe International Airport as we prepare, especially as we prepare for resumption of commercial passenger operations. And as you know, we start on 1st October 2020. And you know that this is what many aviation stakeholders and the industry at large has been looking forward to. The aviation industry across the globe was affected by the outbreak of COVID-19 pandemic, which also led to a suspension of international passenger flights. In Uganda, these flights were suspended on March 22nd, 2020, because there was a need, as you remember, to mitigate the spread of COVID-19, especially which was coming through air travel. With the easing of restrictions in many countries, the aviation industry is slowly getting back to its feet by adjusting to the new way of doing business, especially with observance of health standard operating procedures. That is SOPs, that these present new challenges to airport authorities, airlines, passengers, almost in equal measure. Therefore, no one can afford to be left behind in the implementation of health standard operating procedures, many of which have been harmonized with guidance from international oversight bodies. As you know, Uganda Civil Aviation Authority, in conjunction with air operators, have drawn a plan for resumption of flights in phases. This information has already been communicated to you. The first phase covering a period from October to December 2020. And this is expected to have scaled down operations, and with time, the operations will be increased, and we plan to have more flights in the second phase, which will cover 6 months, and it will start in January 2021. And we shall continue to review the situation as we go on. Ladies and gentlemen, Uganda Civil Aviation Authority has, in conjunction with airport stakeholders, put in place a number of interventions and standard operating procedures to address the challenges occasioned by COVID-19 pandemic in air travel. And I would like to give you the key highlights of these interventions, which include installation of automated sanitizers at various points within the terminal building, and any other aviation facilities, by the way. Social distancing marks on the ground and on passenger waiting seats within our lounges, that is passenger lounges. We have installed glass shields at immigration and check-in counters to avoid direct interface of airport staff with the passengers. Wearing of masks is mandatory within the airport. Terminal building, and anyone without a mask will always be denied entry into the airport. I would like to add, even those who are not putting on it very well will have issues entering the airport. Frequently touched surfaces are regularly disinfected, and this will continue, but passengers will always be reminded to avoid unnecessary touching of surfaces and sanitize after touching documents or surfaces. Announcements to this effect are being aired on public address system wherever there is any flight being facilitated. That will start very, very soon, and you'll be hearing announcements all over the place. Temperature screening is emphasized at all points of entry to the airport. A thermal scanner is deployed in some areas, and it detects temperatures of anyone within 30 meters radius. I would like to explain this. You may not look at it, you may not see it, but when you are within certain areas, a scanner will be detecting your temperatures and will determine whether you are the candidate for screening. There are also ongoing efforts to create more space in waiting lounges by removing the partitions to create open lounges that accord more space for social distancing. Passengers can be facilitated while this is being completed. Departing passengers will be urged to report to the airport 4 hours prior to their flight departure time, to cater for additional time that will be spent going through the added health screening procedures on top of all other existing security regulations. Aircraft will be disinfected on landing after passengers have disembarked before others boarding. All departing passengers shall present authentic, please mark be authentic and valid COVID-19 polymerase chain reaction test certificate. That's the one commonly called PCR. And that should have been issued within 120 hours before travel. And I want to add here, issued by a competent authority. All arriving passengers shall possess authentic and valid COVID-19 PCR test certificate issued within 72 hours before boarding aircraft inbound to Uganda. In special circumstances, where departing passengers are not required to present a negative COVID-19 PCR test certificate in the country of destination, such passengers should ensure that they have clearance from the destination country so as to be allowed on board. Please mark, it is the onus of this passenger to prove that these are exempted. Airlines shall not board any passenger coming to Uganda without a negative COVID-19 PCR test. An arriving passenger without a negative COVID-19 PCR test shall be denied entry, and the airline shall be obliged to take back the passenger. In the unlikely event that a returning Ugandan comes without COVID-19 PCR test, they will be allowed to enter the country, but shall have the test done at their cost and quarantined at own cost till the results are out. A passenger who exhibits signs and symptoms of infectious disease shall be transported in an ambulance to an isolation center. In our case, it is Entebbe Referral Hospital for a COVID-19 test. The results shall be returned within 24 to 48 hours as the passenger remains in the isolation center. In case a foreign national tests COVID-19 positive and wishes to be repatriated for treatment in another facility outside Uganda, this shall be done at their cost, following COVID-19 medical evacuation protocols, which are already in place. There are other details in SOPs, detailed SOPs, which have been shared online. And they are open because we want as many people as possible to be educated about them, because these are passengers and other airport stakeholders or aviation stakeholders whom we want to know what is going on. The aviation industry is very well known to be compliant when it comes to enforcement of safety regulations, as you know. We take COVID as really an additional measure, but otherwise, aviation has always been with rules and regulations, standard operating procedures that relate to safety, because that's why we are here for. That's what we are here for. I therefore have no doubt in the capacity of international aviation in ensuring practical and effective enforcement of the safety precautionary measures for the good of all air transport users. In other words, what I'm trying to say, this is a very normal thing in aviation. We actually operate on SOPs all the time, even without COVID, I should tell you. Therefore, this is just an additional measure that we shall always do. Therefore, aviation actually, as far as COVID is concerned, is the safest